there's a large population which we cater to as asthma specialists. Unfortunately, if you look at the other non-communicable diseases, the mortalities are higher, right? And the mortalities as compared to a cardiac disease would be lower in asthma. But the problem for a pulmonologist like me is all those deaths are preventable. So if you do the right things, probably every asthma death can be prevented. So that's a big statement I'm making, right? So if you diagnose the disease in time, if you do your therapy properly, I think in today's world, right, we do not have a cure for asthma, but the control is very, very good. So majority of patients would be controlled, and I think that will go a long way in this, alleviating the sufferings of those patients. So I think
I
that
want to
would be the
ask you,
important thing.
Dr. Bharat Gopal, the first three things that come to your mind when it comes to dealing with this disease, as far as preventive measures are concerned. What should be those first three things?
So I think three is a very short number, so there will be a lot of this. But I think the first would be education, right? I think I even after 25 years of practicing in pulmonology and going through the whole gamut of how asthma diagnosis and treatments have changed over the last 25 years, I still feel the awareness and education is the key to the success of asthma control. A lot of people have myths. Those myths have to be cleared out, right? Those myths have to be dealt with in a proper way. So that is number one. The second is access to the treatment and diagnosis. So I think that is also something which, because this year we say asthma care for all. That is the sort of a punchline for World Asthma Day of this year 2023. So we have to make the diagnostics for asthma as well as treatment accessible to everyone. So what we find is probably in middle or low income state or areas, probably this is a disease which is not only under evaluated or under diagnosed, it is also under treated. So there are two different things. You not only underdiagnose it, who you actually diagnose, you don't treat them properly. So probably that would be number two. And then the third would be, once you have been diagnosed and have been given a treatment, it is your onus now to follow that treatment properly, because as I said repeatedly, I'm saying that unless you take your therapy properly, right, then the control will not be there.
What are those things that people should avoid when it comes to keeping this disease at bay?
So I think that brings to a very important question called triggers, because as I said, it's an interplay between your human body. You are probably allergic to something, but unless you come in contact with that allergen or that trigger, you would not be probably manifesting the symptoms of the disease. So what are the common triggers? So commonest trigger would be outdoor triggers like pollens. You will have triggers like pets at home. You will have triggers like cockroach dropping. So all these are very common triggers.
Seepage?
Then you can molds, right? So molding, you have seepage in your bathrooms, and you have those whitish deposits which are there, and then they become dust and you inhale. So these are the sort of environmental triggers which are there. Then you will go down to something which you touched at right at the beginning, which is pollution. And I would actually like to bring in the point that it's not only the outdoor pollution or the AQI which should be worried. The indoor pollution is equally at risk. You use carpets, rugs, and you get exposed to dust and dust mites that may actually trigger and precipitate asthma. Then you move on further to emotions, right? You have strong emotions can precipitate asthma. Strong emotions, like if you are yelling, you are psychologically, you can actually lead to a patient who is asthmatic can actually worsen. This we see a lot of it in children.
So
When they,
basically,
yeah,
what I want to ask you, and this is an important point that you raise, is that your emotional well-being is also actually a reason behind a trigger of an existing patient.
yeah,
Okay. So stress, anger.
stress, anger. You even I have patients who have actually developed attack. Yeah, so I have had patients who develop asthma attacks while say crying. So young people will come who would be crying, and then they will go into a sort of, because you hyperventilate and you breathe like that when you are there. Then you moving from there. There are strenuous exercises, right? So people who would go on to exercises sometimes go through that initial phase without having an attack, and once they cool down, they may actually manifest. So there is a pathophysiology behind it, but then exercise. So you have to do, if you are an asthmatic, you have to actually consult your doctor before you take on to some specific exercises. And then finally you look at some medications, right? There are medicines which can, like aspirin. So aspirin sensitive individuals can have asthma attacks if they are exposed to those things. So more or less you will have environmental reasons, you will have psychological reasons, and these will be, I think one thing, diet probably is a overplayed thing, that you don't have curd and you don't have rice and those things. Usually
Thanda khan.
that is, I think, overplayed, because food allergy for asthma is not a very, very big challenge, and that's a very specific thing. Anybody who has that would know it. It's not something that I tell for a generalized statement that if you are an asthmatic, don't eat this, right? So I think that is also important to understand.
Dr. Gopal, you mentioned a couple of very important things, and I think we all should, sort of take a moment to reflect on this, that whatever is there in your surroundings, at home, when you have perfumes, when you have strong fragrances, when you have carpets you think are clean but actually not clean. Also, that seepage on your wall in your bathroom or your guest room, for example, that can be a trigger for asthma. So it doesn't necessarily have to be the outdoor pollution. There are just so many triggers. What about secondhand smoke? We've been underestimating the impact of secondhand smoke. Kids, we're smoking around kids. Even if you're doing it in the next room, the smoke lingers on.
So the smoke is, again, I think, part of that pollution which I discussed. Yes. But if you want to go specifically into it, you'll be surprised to know that pregnant females who smoke, the children born to them have genetically a poor lung function as they grow up. So that is the impact of, you are talking about passive smoking, I am talking about the vertical transmission probably. So a female, an unborn child, is getting exposed even when a mother is smoking. And obviously, if somebody is getting passive smoking and is an asthmatic, this is an irritant like any other. So it will lead to more, say, inflammation and subsequently more symptoms. So it goes without saying that if you yourself are a smoker and you are an asthmatic, or if your spouse or children are smoker, I think it is obviously, it for everybody is good that you quit smoking, right? So I think that probably now is something which we all have been harboring for so many years now. And I think more or less people do understand, and probably should be quitting as soon as possible.
True. I'm reading the questions and various things that the World Health Organization has essentially said about asthma, starting in childhood. My question to you has got to do with childhood asthma and how common it has become nowadays. A couple of months ago, particularly towards, when we were approaching towards summers, there were questions that were being asked by doctors on steroids. And parents kept on asking this, and every second child was on steroids, steroid inhalers. Are we overusing this medicine? First of all.
So, okay, so we are just jumping topics, but I'll just try to reframe everything. First thing is, you talked about childhood asthma, right? Definitely, no doubt, the incidence of childhood asthma has increased. The reason is that we are probably, at least in urban areas, we are detecting them more. It is not, because if you look at these studies, they will show that, say if you look at Pune, so there was a study which or the same center, they would found that actually the incidence has gone down because of the changes in environment in childhood, right? But the absolute numbers have gone up. So they are two different things, because that happens because, see, earlier people are not coming forward. At least in urban areas, the awareness has become so much that they will come and they will get the diagnosis done, number one. Number two, if you look at the overall prevalence, the studies show that at least in India, it's around 8%. So that's quite a lot in children. So out of the whole childhood age, if 7.9 to 8% are having asthma, that's a huge burden of disease in people. So that's what I said, the numbers are going up. We are detecting them more. Those children who were labeled as maybe seasonal allergy, seasonal bronchitis, are now being properly nomenclatured as asthma. So that is important, because then you treat them properly. Otherwise you will just, as you said, you will give them cough syrups and antibiotics and just leave it at that. While that brings to the second part of the question which you asked about inhaled steroids. Now, let me please clear it up that inhaled steroids, if required, are the gold standard treatment for bronchial asthma. Why? You have inflammation in the lungs. The best anti-inflammatory drug in the world, which humankind has known, is steroid. The good thing is that what we are using are not oral steroids. So these are not the steroids which we used in COVID and create a lot of problems. So that is something which everybody needs to know. These are steroids which we use for inhalation. So these are in micrograms as compared to milligrams of the oral steroid. So obviously that's the difference. Secondly, everything which goes in is not absorbed into the blood. Even a very small proportion actually goes into the blood. So that is practically very, very low to cause systemic side effects. The commoner, obviously anything which is given is not without side effects. Any medicine which is made, if something has effects, it will have. So that's why I'm saying I would not actually say overuse. In fact, the data shows that we don't even use them where we should. But right use is the word which we should, that it should be appropriate. Any drug, forget about inhaled corticosteroids, any drug should be appropriately used in the right setting, in the right dose to the right patient. So that is something goes beyond saying. So let's at least clear this thing that inhaled corticosteroids, if your doctor is prescribing, is the treatment of choice for if you are rightly diagnosed at bronchial asthma.
Okay, so they're safe to be used?
Yeah, they are safe. They are safe. There are extensive studies for long-term use of steroids, right? They used to think that if children use it, they will have stunted growth and those things. In fact, they found that if you don't use it and your asthma is uncontrolled, you would have worse. You will do worse as a child than if you use your drugs properly.
We have a question. What are the emotional triggers for asthma? Okay, that is what.
Yeah, what we discussed, we just. So I think emotional triggers could be right from crying and loud singing and loud dancing to even getting stressed like anxiety, depression, people who get panic attacks, and those things can actually trigger if you are an asthmatic. And sometimes it becomes very difficult for a doctor to actually make out if this is an asthma attack or it is just a hyperventilation secondary to panic.
Also, we have another question on the fact that is there a link between asthma and COVID?
Not really, because obviously they're two different things altogether. COVID is an infection, and as I said that asthma is more of a sort of a genetic disease where once you come in contact with unfortunately with the right trigger, you develop that inflammation. So there are two different things. COVID in a patient of asthma can precipitate an asthma attack like any other viral disease, right? So that is there. People who had severe COVID and had asthma definitely did not do very well because their lungs were already compromised, and when they developed severe disease of COVID, we had a tough time in. But are they interrelated? No. So did anybody develop asthma after COVID? No. Did people develop some sort of lung issues after COVID? Yes. But they are not asthma. So I think this is not the platform to discuss, though. Maybe sometime we'll discuss the lung diseases post-COVID.
Okay, Dr. Gopal, I also want to ask you, a lot of people will want to know that what do I do? Like for example, somebody like me, when I know that I have patients in my family, what should I then avoid? Because, I don't want to be diseased, and I also want to take the right kind of precautions and then in that direction. What precautions must I take?
So apart from avoidance, so which is the first thing which you can do if you know your triggers, right? So somebody knows that there are people who will come that we get attacks when we take out our clothes after winters. Winters are setting in, and we take out and all the naphthalene balls and everything, and the dust which is there, we suddenly get no. So if you know that, you have to obviously avoid or take appropriate barrier precautions before you do it. The second very, very important thing which I think we underestimate is the correct therapy and regular therapy, because that is, if you allow me, probably I think the important thing to understand is that the therapy has two parts. One is the reliever. So when you feel breathless, I'm out of breath. So in one part of that inhalation therapy, or say one part of inhaler or one type of inhaler, will give you relief from your immediate bronchospasm or that tightness which you are feeling. But that is only temporary. That is only for that particular moment. you need another part of therapy which is going to prevent your further worsening, further swelling inside, and further attacks, which is taken care by the inhaled corticosteroids, right? So these are two parts of that. Usually now we have this available in one inhaler, but you can actually use them in two different inhalers also you want. So prevention of subsequent worsening is as much a part of asthma management, which unfortunately a lot of doctors also don't somehow probably understand, because that is an awareness not only to the public but to so many doctors, because every doctor may not be keeping abreast with the newest things which are occurring. So that is very important to understand, that sometimes if you know that somebody is an asthmatic, to prevent those attacks and prevent the progression of disease subsequently, right, you need. So when you talk about prevention, A is avoidance, B is this, and C, I would like to put it that sometimes when you are, some people have asthma attacks or triggers when they are exposed to flu. So vaccinations for flus and pneumonias in the right appropriate age group can also be, yeah, but because if you're no. So again, there is no cure as of now for asthma. It's just managing your disease and doing it well, right?
Okay, my question to you, and this is going to be my last question, is the symptoms of asthma. Because what I saw around when I spoke to a lot of people around me, in fact, even in my family, that there is denial that this is asthma. Doctors are just in the habit of scaring their patients. Sorry to say that. But, at the risk of sounding alarmist, a lot of doctors go and say that, oh, this is asthma. It may or may not be, and hence a bit of suspicion or doubt on whether there is any truth to it or not. So what I want to ask you is that what are the classical symptoms of asthma, and how do you distinguish it from the regular allergy attacks, if I can call it?
So as I said in the beginning, let's not go into the names. So most of these allergies which are labeled are asthma, right? So allergic asthma is an asthma, right? You said, I would actually beg to differ, that I feel that still if you do a prescription survey from all over the country, you would find that the term bronchial asthma is, even the doctors are a lot of very careful to use it, because they also know that they are not sure, because as I said, the access to diagnostics is also not there all over the country. So you need, apart from your symptoms, like you have, say, wheezing, you have chest tightness, you have cough which doesn't go away, you have breathing difficulties, maybe on slight exercise, right? You have disturbed sleep. All these could be pointing towards asthma, especially if you know that they have been precipitated because of exposure to a certain trigger, right? So in that correct perspective, these are all symptoms of asthma. So how do you diagnose? So you have a lung function test which can actually help you diagnose and objectively classify that this is asthma. What we are talking about is subjective. So as you rightly said, that those subjective things can be because of 100 diagnoses which lead to breathlessness. So then that lung function testing would actually help you diagnose the disease and actually also categorize the severity of the disease, which can actually help you plan the therapy. So that is also very important, right? So rather than saying that somebody is getting scared, I think it's the time that because if you, a lot of people go into this denial mode. I was telling you off air, around a half an hour back, I saw a patient, young guy, who was saying, no, he has symptoms for last 5 years. But he is into that, no, I don't have asthma, doctor. So I had to spend 20 minutes to actually convince him to do a lung function test, and that lung function test came as 56%. So he was breathing as 56 and capacity was say 56%. So he's saying, no, this is just occurred 2 days. It cannot occur in 2 days. So that is the type of thing that people need to understand, that okay, we need to diagnose, and once you are diagnosed, please take appropriate therapy. It prevents you from worsening. It prevents you from hospitalization.
Can be managed is the bottom line.
Very, very well.
It can be managed very well is what Dr. Bharat Gopal is saying. I want to thank you for joining us. It was a great conversation about asthma, and hopefully, because the incidence of this disease is only increasing in the country and there's a growing burden, so to speak, there should be more awareness around this disease. And of course, we all know the triggers for all of us is not just the pollution. There are several other things, and that should be taken into account, especially for those who are susceptible.